We're live.
We're live?
Yeah.
Okay, I'm gonna put you back here, Jill.
Okay.
Maybe. I can put you on the chair. Okay, so we're making a video for an oral cancer screening. Okay, so so what I typically like to do is I first check their jaw joint. Okay, so I'm gonna run through. I'm gonna have you open real wide and close and open and close. And she's got a little click on the right TMJ that I can feel. Okay, any pain with that?
No.
So I typically just ask, and if they're not, great. And you move on, and I typically just slide down here and follow the bottom of the jaw. Okay, just feel around. Any tenderness here?
No.
Good. And for you, Jenny, I'm going to do this. I typically don't, but we'll do the thyroid here. So
Okay.
Open and close, and I'm going to have you swallow now. Okay, good. And what you're feeling for is anything abnormal. Okay? And I'm going to have you open, and you're going to go ah.
Ah.
And so what I'm doing there is I'm looking at the back of the throat for anything that's abnormal, which she looks great. Bite. And then I'm going to take a look, have her bite together, and I'm looking at all the tissues of the lips, kind of the vestibules. And everything's looking good. And open. Is this what?
Yeah.
And then I take a 2x2 and I have her stick your tongue out for me. And open, and all I'm looking for is the sides, the lateral borders of the tongue. I look on both sides, okay? And all I'm looking for is anything that's white or red that looks abnormal, and everything looks great. So now I'm gonna have you stick your tongue to the roof of your mouth. And the last thing I do, the reason why I do that, is because I'm looking for the floor of the mouth. The most common areas to get cancer are the floor of the mouth and the lateral borders of the tongue, okay?
What would some changes that you may see be?
And bite. Huh?
What would the colors look like if you were seeing some change? Like,
I mean, you'll notice it be, you know, leukoplastic. It'll look white, like a patch. You know, for tobacco pouch keratosis, you'll see that change of the tissue. It'll turn a whitish color, and so those are things that you're looking for on the floor of the mouth or on the lateral border of the tongue as well, everywhere for that matter. And then, you know, for tobacco pouch keratosis, in the vestibules where they typically have it, and that'll typically just go away. What you're looking for also is ulcerations.
okay.
Okay, so if there's any ulcerations in that patch, that's concerning.
Okay.
Okay, or anything invading.
All right.
So, okay.
Yeah.
Anything else?
No. Thank you,
Okay.
Dr. Brandt. Thank you, Jill.
Good job, Jill. You're a great patient.